Welcome all to this webinar on the consequences of COVID-19 on those affected by forced displacement in the global south. And what I'm particularly pleased with, I have to say, is that from what I see from the list of participants in this webinar, there are indeed a lot of people from the global south. We have over 500 people who have signed up for this event, and you are from all over the world. So good morning, good evening, good day to you all. My name is Bjorn Gilsetter. I'm the head of the Joint Data Center on Forced Displacement, based in Copenhagen, in Denmark. And I have the pleasure and honor to be moderating this session. And before anything, let me just point out that this meeting is being recorded. I click continue. That's okay. I hope that all of you are comfortable with that. This webinar is the third in a mini series that we are happy to co-organize in collaboration with colleagues from the Center for Effective Global Action at Berkeley, California, and Innovations for Poverty Action. For those of you who did not follow on all three, in the first webinar, we looked at the evidence coming from Kenya, Uganda, and Bangladesh. In the second, we focused on Syrian refugees in Jordan. And today we are discussing preliminary results emerging from high-frequency phone surveys in Ethiopia, Yemen, and Ecuador. So truly a global exercise here. And to this aim, we've invited three senior economists from the World Bank, what the global practice called Poverty and Equity Global Practice, and I will introduce them shortly, very briefly. We've asked them to present their work in their three respective countries, and I think in all three cases they have benefit from direct or indirect support from the Joint Data Center. The evidence will then be discussed by two colleagues from UNHCR, one representative from headquarters in Geneva, and one from the field in DRC. I think she's based in DRC. Or Republic of Congo. I'm just want to upfront thank you all for accepting this invitation. In the last part of the webinar, there will be time for speakers to answer your questions that you may have regarding their work, and we invite you to post those questions in the Q&A function. And just to note, please don't do it in the chat. It's deactivated, but use the Q&A space. We intend to use this Q&A space interactively, so some of the answers may be coming straight away in the margin of your screen. The webinar will be made available on the website of the three organizations, so that you know that you can go back and rewatch it anytime you like. Please note that by attending this webinar, you consent to the recording of any content that you might post in the Q&A space. I will not take up a lot of time talking about the Joint Data Center, but I do want to say just that we're a relatively new actor, a new kid on the block. It's a collaboration between the World Bank and the UN Refugee Agency, UNHCR, with the sole purpose of supporting a quantum leap or a step change in the availability and quality of data on those affected by forced displacement globally. In developing countries, in the global south, whatever you want to call them. We do this in many different ways, and I won't go into any of that just to spare time and keep the focus here on the presenters. but please visit our website if you want to know more. We have a special work stream on everything related to COVID-19 and forced displacement. We've developed together with colleagues at in the bank basically a stock take on what we know and what we don't know about COVID, the socioeconomic consequences of COVID. We came out with that paper in December last year. We've also activated, collected a primer, reaching out to a network of researchers to get a sense of what research is ongoing on the socioeconomic consequences of COVID by research institutes and by think tanks and other outfits. And finally, and this is very much linked to what we're talking about today, we support high frequency phone surveys in a number of countries. And I think we have a slide, a colleague of mine will put that up in a second, just to give you a snapshot of where we are supporting such high frequency phone surveys. And you will see that these are some of the countries that host the largest amount of forcibly displaced, whether it's refugees, IDPs, stateless people. So that's enough about the JDC. Let's go to the content of the seminar. We have about 80 minutes together. We have structured it so that we will invite the three speakers to talk for up to 12 minutes about their respective countries' exercises. We have asked the discussants to limit their interventions to 8 minutes. And after that, we will respond to questions and comments, again, that is coming in the Q&A bar on the website. Note that for technical reasons, the microphones, you will not be able to post your questions orally. So do use the Q&A function. So let's go to Ethiopia. Christina Wieser, a senior economist, I think sitting in Addis, working for the Poverty and Equity Global Practice, one of our great collaborators. And I know that you've come really far. You actually already have I think an early analysis of some of the work, the high frequency work that you have supported. So we're really looking forward to hearing you talk about that. So please, the floor is yours.
Great, thank you so much. Thanks so much, Björn. So my name is Christina Wieser. I'm a senior economist for the Ethiopia World Bank Country Office. And as Björn already mentioned, I would like to give my sincere thanks to the JDC, who has made this work that I'm going to share with you possible. So we've received not only funding through the JDC, but also the team at the JDC has been very heavily involved in this work, which has been very useful, and I'd like to sincerely thank the team. Also, I'd like to thank UNHCR and ARRA. ARRA is the refugee agency in country who we have worked with very closely on this survey. They've been very supportive of this work. And so my sincere thanks goes out to them, as well as the UNHCR team, without whom this work would not be possible. So I'm gonna walk you through some of the insights from the phone surveys in Ethiopia that looked at the COVID-19 impacts on refugees. I'm gonna briefly walk you through sort of an overview of refugees in Ethiopia, for those of you who are not very familiar with the context. Then speaking a little bit about the rationale of the survey, the approach, as well as the representativeness. And the reason why I am focusing to some extent on methodology questions is because we were some of the questions that came in as part of the sign up for the webinar were very heavily focused on methodology. So I wanted to make sure to present this early on, and please feel free to ask any follow-up questions if you have. So there are about 800,000 refugees in Ethiopia. So this is the 6th largest refugee population in the world, and the 3rd largest in sub-Saharan Africa. So the impact of refugees on Ethiopia and also on host communities is substantial. Most of these refugees have been in country for decades, and the majority of these refugees are from South Sudan, Eritrea, Somalia, and Sudan, not surprisingly given the location. The majority of refugees are housed in camps with limited economic opportunities up until very recently. And so therefore COVID-19 presents an additional threat to their livelihoods as they are sort of largely confined to camps. However, the government of Ethiopia did make very significant progress and implemented a refugee policy that allowed refugees to pursue economic opportunities outside of refugee camps. So this was very well received, not only within Ethiopia, but also by the international community. So very, very progressive policies there. And the government of Ethiopia is also in very strongly trying to enhance the integration of refugees in the national social protection systems. We work very closely with the government of Ethiopia, and they also have very close ties, of course, to development partners to promote opportunities for refugees and host communities in Ethiopia. The rationale for the survey, so why did we even think about implementing the COVID-19 high-frequency survey for refugees? So what we've seen from, so we have already started in April a high-frequency survey of households, of national households, the national population. And what we saw from that is that the impacts of COVID-19 are significant and they're very widely felt in Ethiopia. And we also saw large variations across different population groups by location and over time. And COVID-19 is also very uncertain in terms of its duration and the evolution of the crisis. And so it was very important for us to not only look at the national population, but also to look at the sizable refugee population in Ethiopia. And the idea here really is to monitor the impacts based on COVID on these populations, and that was simply not possible with existing data sources. They are outdated, infrequent, and in Ethiopia, as in many other countries, traditional face-to-face data collection was suspended. And so the solution here then was to try to implement a high-frequency phone survey, which can provide timely and accurate data. It allows for the comparison of impacts not only across different refugee populations, but also of refugees to national populations. And we were able to field this survey of refugees alongside the survey that we already had in the field since April of the national household population. So in terms of timing, we had to kind of overlap the household survey and the refugee survey. So the household survey, as I mentioned, started in April 2020. And by the time this idea of including refugees as part of this survey effort came about, we were really quite far into our data collection process already. Nevertheless, we were able to include refugees in round 6 and round 7 of the national household survey. In terms of the target group, so the household survey that we have is national representative and representative for urban and rural areas. However, the refugee sample is not representative for the entire refugee population in Ethiopia. It is representative for the refugee population in the sub-office Shire, Chichiga, and Addis. And I will talk on the next slide why that is and what that really means, these sub-offices. The sample size for the national survey is about 3,000 households, and for the refugee survey about 1,600 households. The national survey is collected every month for 12 survey rounds. So we just finished collecting round 10. However, the refugee survey was implemented for 2 rounds alongside round 6 and round 7 of the national sample. We used phone data collection using CATI, a modular structure of the questionnaire, which allowed us to move certain modules in and out of the survey. And we received funding from the JDC, and we also had a question early on the cost of these surveys. So in Ethiopia, for only the refugee sample, it was about $15 per completed interview. Now, this is, of course, this will vary largely by country and by by the situation of data collection in the country. But in Ethiopia was roughly $15 per completed interview. Now, another important thing to mention, I'm sure most of you have been watching the news on Ethiopia. There is currently conflict in the north of the country. The conflict erupted at the beginning of November, and to some extent it overlapped with part of our data collection effort in round 2. So round 1 was collected roughly in October, so that was not impacted, but round 2 was collected mid-October through mid-November, and especially towards the end of that data collection effort, the conflict did affect data collection, and our response rate for refugees that are based in camps in the Tigray region dropped to about 79% in round 2 compared to round 1. However, we had already oversampled the Eritrean refugees, and so therefore we were still able to have a representative stratum of Eritrean refugees, despite us not being able to reach every single household that we interviewed in round 1. So in terms of representativeness, this can of course be a concern with phone surveys. The biggest reason of which is of course because we can only get to the population that has access to a phone, which of course creates somewhat of a biased sample. Now, for the case of refugees in Ethiopia, an additional concern was that there was very large variation across phone penetration rates across the different refugee groups. Now, the table that you see here essentially shows the number of households for each of these sub-offices. And essentially a sub-office is just an administrative division of UNHCR by which they organize themselves. And so all the information that we had readily available was by sub-office. And this largely corresponds to regions in Ethiopia that host the largest refugee groups. And so what you see on the right column of this table is that phone penetration rates vary substantially. While those refugees who live in Addis have about 90% of them have a phone, it's less than 1% in the sub-offices of Gambela and only about 3% in Asosa in the west of the country. Now, what this means is that we, of course, couldn't include refugees who have very low phone penetration rates. And so what we did in order to construct our sample, we only included refugee or sub-offices, so refugee groups with relatively high phone penetration rates to not introduce additional bias. And so what we did here is that we only drew a sample that's representative for out-of-camp refugees in Addis Ababa, for refugees living in the sub-office of Chichiga, and that largely corresponds to Somali refugees. And in the rest of the presentation, I'll refer to them as Somali refugees. And then also we have a representative group of Eritrean refugees served by the sub-office, the UNHCR sub-office in Shire. Now, so now in terms of this is how we approached this high-frequency phone survey. So now, of course, also want to show you sort of some of the highlights. So we have finalized both data rounds. We have analyzed both rounds. We have written reports, analysis on both rounds. So we have a pretty good sense of how refugees were affected in Ethiopia. And I would like to show you through some of the high-level results. So when we look at access to the main staples, we asked refugees whether they were able to access crucial items. So we looked at medicine, teff, wheat, maize, and edible oil. And what we actually see is that refugees were more likely to access these items compared to the national population. So what you see in this top graph is that the refugees, both in round 1 and round 2, had much larger access to some of these important items compared to the national population. And this is, of course, largely due to the type of living arrangements they have, that they receive that they receive food through camps, which made it less likely that they struggle to get some of these items. We also see, though, that refugees are more concerned about illness and finances compared to the national population. And so this is what you see at the bottom of the graph. So when we looked at the refugee population that is very or somewhat worried to fall seriously ill, them or their household members, we see that about 3/4 of the refugee population had this worry, but only slightly over half compared to the national population. And keep in mind that this is already, this data is of October, so this is about 6 months or 5 months into the pandemic. Similarly, for the pandemic posing a substantial or moderate threat to household finances, the refugees had higher concerns compared to the national population. Now, one thing that's of course been on everyone's mind as part of this pandemic is the impact that this pandemic has on the education of children, given that schools are closed. So in Ethiopia, schools closed very early in the pandemic, already in mid-March, and children were able to, or should have been able to access distance learning opportunities. And so we wanted to see not only to what extent are children able to go to school before the pandemic, but also if once schools were closed, how did they access learning activities? And what we see, so there's two striking facts when we compare the refugee population with the national population. The first striking fact is that very few refugee children attended school before the pandemic compared to the national population. This is what you see in the top graph. So only about 2 in 10 refugee households sent their children to primary school before the pandemic. And this is compared to 7 out of 10 for the national population. And an even smaller share of refugee children attended secondary school, only about 5%, and this compares to about 24% of the national population. So going to school was a big challenge for refugee children before the pandemic. But what we see, quite curiously or interestingly, is that actually, even though very few children were able to go to school before the pandemic for refugee households, those that did go to school were a lot more likely to engage in distance learning activities during school closures. And so when we compare refugees with the national population, we actually see that about twice as many refugee children participated in distance learning activities compared to the national population. However, we have to again keep in mind that very few of refugee children had an opportunity to go to school before the pandemic and still had an opportunity to engage in distance learning activities. We also wanted to see how refugee children were not affected, but how they engaged when schools reopened. And we actually see that about 10% of all refugee children, schools reopened in November. So in Ethiopia, there was a phased reopening of schools. During round 2 of our survey, so in November, schools reopened, we saw that by the time our survey was in the field, about 10% of schools had reopened, with quite large variations across the different refugee groups, with Somali refugees actually showing the highest percentage of schools having reopened. Another important impact on sort of livelihoods. Yes.
I'm going to have to ask you to start wrapping up.
Yes, I am. So in terms of job losses, we see that they were very severe for refugees. Compared to the national population, very few refugees work, which again is a result of the living situation or the policies around encampment. And what we also see is that the job loss compared to job loss as a result from the pandemic was quite large. So we see that pre-pandemic, about 28% of refugees were employed, and this dropped to about 19% in October. Total household income was also very severely affected. So this was a particular concern for refugees who live in Addis Ababa. Those are the largest group that lives out of camp. And what we see is that they did struggle with income losses, particularly in round one. We did see that government and the international community responded quite well to the pandemic. So refugees did receive quite a lot of assistance. This is especially compared to the national population, where less than 5% received assistance. And so this again is largely due to the international community as well as the government providing these resources. The key findings on these impacts that we see is that there were major impacts on jobs, income, and education of children of refugee households. We see that there were uneven impacts across the refugee and the national population. And the biggest concern here, of course, is that it may widen pre-existing inequalities. And we also see that social assistance was an effective mean by the government and the international community to curb the negative impacts. Thank you.
Thank you very much, Christina. It's super interesting presentation and results from your work. I see very positively that there are good questions for you, Christina, in the chat, in the Q&A chat. So please go in and respond to those that are directly for you. And meanwhile, while you do that, we'll turn to Yemen. And Sharad Tandon is our next speaker. Sharad is a senior economist, also at the Poverty and Equity Global Practice at the World Bank. The floor is yours. We see your slides, but we don't hear your voice yet.
There we go.
Yeah, sorry. Now we do. Thank you.
Technology is still a trouble for me, even a year into this thing. But hi, everybody. My name is Sharad Tandon. Thank you very much for having me. Today, I'm just going to briefly kind of present some of our monitoring work that we've been doing in Yemen on COVID-19 and kind of the impacts of COVID-19 on both host and IDPs. But it's important to note that this is actually very much joint work with the WFP, who I want to say has done excellent work collecting wonderful data throughout the conflict in Yemen. And then I also want to thank the JDC for their support in doing some of this work and then extending some of the monitoring that the WFP is doing as well. Okay, so as most of you know, there's a pretty large displacement crisis in Yemen since the escalation of conflict in 2015. So at the very start of the war, there was a big spike in displacement, and ever since there have been roughly equal flows of newly displaced households and returnees. So overall, the share of the population that's reported to be displaced at any one time is hovering between like 10 and 12%. But the composition of that group is changing over time. And when you ask households, kind of the primary reason for displacement, they report violence being the primary reason. In addition to the displacement crisis, there's obviously a very bad conflict going on that's really harming the population. And this makes it a really difficult time for COVID-19 to hit the country. In particular, the health system in the country is already severely overtaxed. It's poor facilities. They don't have enough supplies. They don't have enough personnel, et cetera, et cetera. They're dealing with other health epidemics of cholera and chicken and mosquito-borne illnesses. So it's a really fragile system to ask to put an additional burden on with COVID-19. Additionally, on the flip side, the population in the country is always one small push away from famine. So any impact on their income is potentially quite harmful. So amidst all these potential horrible impacts, there's also a reason that IDPs might be hurt worse by COVID-19 than host populations. So some factors about where IDPs live, and how they live actually make them potentially more vulnerable to both the medical and economic impact. So IDPs tend to live in larger households. They tend to host other IDPs more often, and they often live in populated areas which are potentially going to be more susceptible to COVID shocks. Alternatively, regardless of the size of the shock, IDPs themselves might be less able to cope with shocks than host populations, having lost their networks, used up all their savings and sold assets. So there are reasons to think that to monitor in particular the impact of COVID on IDPs relative to hosts. So, what we do here is we examine the impact overall, and then we break it up between IDPs and hosts. And I'm going to let the cat out of the bag a little bit early. What we find is COVID actually didn't have that large of an impact on Yemen. It had a moderate impact, and it's definitely a negative impact. But at the same time, the country wasn't as affected as other countries in the region or the world. And then importantly, hosts and IDPs were affected identically. There was no difference in how they were impacted. And so what we do is we actually compare the COVID-19 shock to other shocks that the Yemeni population has faced, and kind of put it more in the Yemen context to understand why COVID-19 might not have had a larger and more immediate shock or impact. So throughout, we use a survey that was pioneered by the WFP since the very beginning of the conflict. And they've done a really remarkable job in a very, very difficult data environment. So beginning at the very beginning of the conflict, and that's actually a typo with September 2015. They started in July 2015, which is 4 months after the conflict escalated. And they began by reaching 2,400 households per month, every month since the start of the conflict. And then that increased, independent of COVID, to 4,200 per month in March. That was a pre-existing plan. And so in the first month, they reached all 2,400 households via random digit dialing. In the second month, what they did is, in subsequent months, 80% of the sample of the 2,400 households were households that had been interviewed in previous rounds, and 20% were those that were new respondents reached by random digit dialing. Now, the survey primarily tracks food security, but beginning in March 2019, we also added access to education and access to health as dimensions that are tracked. In addition to those welfare modules, the survey also includes a short displacement module. It asks if a household was displaced, and if so, from what governorate and what month and year. So this seemingly very simple and crude displacement module actually turns out to be quite powerful. When you combine it with the other food security information, with the other conflict data, and then also especially when you incorporate some of the panel aspects of the survey, where for a subset of households you can actually observe how welfare is trending leading up to displacement and following. And then it's also important to note that through this random digit dialing, we're actually reaching a very large number of displaced households. By over the entire course of the survey, between 25 and 40% of the households report to being currently displaced, and now that's on the higher end. Over time, it's slightly increased over time. So there are a significant share of the sample that are displaced. And then also, beginning in April 2020, approximately 15 days after the pandemic began, we also inserted a COVID-specific module that looks at specific ways in which COVID might be harming the population. The labor market impacts, the degree to which people are social distancing, the health impacts, and so on and so forth. So many of you are probably already wondering, and rightfully so, how representative are these surveys? Unfortunately, I only have 12 minutes to talk, and I can spend more than 12 minutes just on this issue. And the first thing to note is that these are not perfect surveys, and we fully understand that. But unfortunately, in the Yemen context, this is the best we can do. So the three questions in particular that we have to be concerned about is first, similar to Ethiopia, the surveys can only be representative of the mobile phone using population. So prior to the conflict, mobile phone penetration was quite high in the country, and looking at project data and the WFP survey itself, which collects information on the number of mobile phones that each household owns, those two sources actually suggest that mobile phone penetration has still remained quite high. Although we don't have an official estimate, the survey certainly captures well over most likely well over 50% of the population. But that being said, there still are significant portions of the population that are missed. The second really important issue is that non-response in RDD surveys are a really important issue. And we have to make sure, we're not getting this sample that really isn't responding in ways that the larger population is responding. And to the degree that we can, what we do is we investigate, how the degree to which the WFP survey is picking up welfare declines that are reported by other humanitarian agencies and news sources, as well as comparing them to other, kind of nationally representative estimates from other sources. So in particular, there are things like food assistance that we have from other sources. There was a nationally representative food security assessment that we can compare to. And then also looking at the declines that have been reported by humanitarian agencies. All those three factors, the WFP surveys seem to be, corresponding quite well to all those sources of information. So, the surveys aren't perfect, but we're quite, confident that they are providing some good information. And the last thing that you need to be concerned about, particularly when you're looking at the impact of shocks, are, the shocks themselves might actually affect people's ability to access mobile phones and to actually be represented in the survey. So we also thoroughly go through and estimate to the degree that we can, and it doesn't look likely that the shocks that we're discussing here are affecting people's access to mobile phones. Okay, so with all those data questions kind of in the background, what impact did COVID-19 have on the population? So the two dimensions in which we can actually look in detail are poor access to healthcare and poor access to food. So here, what you see following the start of the pandemic in March of 2020, you actually do see an increase in the share of households that report poor access to healthcare. And then you see that share is continuing to increase through June and July, where it kind of stabilizes and starts decreasing a little bit towards the end of the year. Now, turning to that COVID-specific module, you see that we actually ask households, why are they having problems with access to healthcare? And the primary response for both hosts and IDPs are lack of money. And this is also consistent with the same module, which shows that approximately between 20 and 30% of households report to being paid less than they were before the pandemic. So all these things suggest that COVID-19 did have a negative impact on access to health. But there are a couple things to note here. So the first thing to note is that actually, even though the poor access to healthcare increased at the beginning of the pandemic, the increase actually wasn't that large compared to other increases that have happened over the past year. And you actually look at the share with poor health access, and that's actually very similar to what it was. It's slightly larger than any other point of the survey, but it's very similar to the levels in 2019, maybe 2 or 3 percentage points higher. So yes, there was a slight increase in negative impacts, but it wasn't huge by Yemeni standards, which is quite unfortunate. The second thing to note is that there are other things going on besides just COVID, because unfortunately that's the kind of situation Yemen is in. Particularly, if you can see this best in that bottom left-hand graph, where you see in July where the lack of money between hosts and IDPs starts converging for over the rest of the year. But actually, starting right around June or July, what happened? Our food prices started escalating to almost record highs in the country. So there's other things going on that are causing households to be financially stressed beyond COVID. So that's also important to keep in mind, and that some of the, especially later impacts are difficult to attribute only to COVID. And the last thing to also mention is, that everybody in Yemen pretty much has poor access to healthcare, or the vast majority of the population. What actually determines poor access to healthcare is whether you get sick. And so the way the question is quoted is, did you require medical assistance, and were you not able to get that assistance? So actually, basically, you know, if you look at one household over time, approximately, you know, there's a very, very high likelihood that all households that have been included in multiple rounds of these surveys at some point face poor access to healthcare. So it is also very much a function of, you know, people just didn't have money at all, and that when they get sick, whenever that happens, they just don't have money to pay for healthcare. And that corresponds to the peak of where poor healthcare, where poor access to healthcare was at its highest, which is June of 2020, which is exactly when the highest number of cases and deaths happened in the country. So there was a large peak at that point in time. Okay, so there were moderate impacts.
Sharad, can I ask you to start? Can I ask you to start wrapping up?
Yes, absolutely. So there were moderate impacts of COVID-19 on access to health, but then when you look at poor access to food, you see very little impact at all. And for both of these things, they're very similar between IDPs and hosts. And so that's actually quite surprising with the share of households that report poor income, that why there wasn't or less income, why there wasn't a larger increase in decrease in access to food. You see over time, again, poor access to food increased, but then that again was in part due to the price increases as well, and not necessarily just COVID. So this is the last slide. So sorry for taking a little bit too long. So these patterns actually suggest more questions than answers. So the first question you might have is, why didn't COVID-19 have a bigger impact? And so the most important, you know, kind of reason is that Yemen has had to deal with so many different shocks, that many of which actually had potentially worse shocks to income than COVID-19. So the thing that Yemen is most susceptible to are huge spikes in prices of food and fuel, which really decline real income. And the size of these spikes are such that many of these income shocks are kind of, you know, from COVID are much smaller than these shocks to prices. And these affect the entire population and not just 30% of respondents. So unfortunately, this is a situation that Yemenis actually have to deal with a lot worse, and often with shocks, you know, kind of similar to COVID. The second question you might be asking is, why didn't the pandemic affect IDPs and hosts differently? And so the reason we're converging to as a team is that hosts and IDPs might have similarly exhausted their coping strategies. So the logic of IDPs being worse affected actually depends on hosts being relatively unaffected and IDPs spending down their assets and so forth. But this is a case where hosts are really, you know, buffeted, you know, are really hurt by all these conflict-related shocks. So they also have spent down their assets to a large degree. They also have spent down their savings, and it's difficult to rely on networks when they're in a similar situation to you. So this is a situation where hosts and IDPs actually tend to be more similarly affected by all shocks in the country. And so looking at a lot of these other shocks, you actually see in the vast majority of them, hosts and IDPs are actually affected similarly. And I'll go ahead and stop there. But we are doing ongoing work to look at the types of shocks that are more likely to affect IDPs and hosts differently. But thank you very much.
Well, thank you, Sharad. Terrific presentation. And it's just fascinating the kind of results that you're able to show here, almost in real time. It's this pandemic, if there is any silver lining, it is that we've been all forced to innovate and do our work a little bit differently, and I think that has really produced some work that is highly needed and should have come a long time ago. It's fantastic. Thank you so much. I'm sure there are questions for you in the Q&A chat. Please go there and answer as many questions as you can, Sharad. All right, next we're gonna take this airplane over to Ecuador. And Sergio, you may notice that the background on my picture is actually of the Galapagos. So I'm very close to the country that we're going to talk about next. Sergio Olivieri is also a senior economist with the bank, and I think you are presenting together with Ana Mercedes Rivadeneira Alava, who is a consultant in your team. The floor is yours, Sergio. You have 12 minutes. Thank you. I think just want to mention that at least in the case of Ethiopia, these early rounds of the surveys are being documented in briefs, in short papers summarizing the results, and I think in an effort to share the outcome of this work as early as possible, simply to make them as impactful as possible. Impactful in the way that they influence policy dialogue, that they influence allocation decisions and the likes. And without putting you too much on the spot, Betsy, it would be great if we could hear a little bit about that. How do you find the results of this kind of work relevant for UNHCR's work, and in terms of guiding your response and similar? And I see that one of the questions in the chat was indeed about this. So I think the question was, how have actors such as governments, UN agencies, NGOs, et cetera, been able to use this data to shape emergency response? So with that little intro, Betsy, wonderful to have you join us. Betsy is a senior advisor in UNHCR in Geneva, in a division called Division for
Resilience
and Solutions, DRS. Thank you, Betsy.
Thanks, Bjorn. Okay, I'm going to start out by saying I am not an economist. So I have no graphs and I have no data points. And I hope I'll be able to do it in under 12 minutes. Maybe that'll be the comparison between me and the economists. But I also want to thank the JDC and the World Bank, and we really appreciate the partnership. We've always seen it as very complementary. The one thing UNHCR does bring is knowledge about our population and the situations, but the technical expertise that we get from the World Bank and the JDC is just, I mean, it brings such added value to us. We really appreciate that. So maybe let me just frame the issue first, Bjorn. You know, more generally about how COVID has impacted the populations of concern and how we see the pandemic. We know that the pandemic has had devastating consequences across the globe in low-income countries and middle-income countries primarily, but not least for those that are often marginalized. And that obviously includes refugees and other populations of concern that UNHCR is mandated to support. And COVID has certainly made efforts to address, you know, what is the worst forcibly displaced crisis since World War II, with almost 80 million people displaced, much more complicated and challenging. And I would say, perhaps not surprising, what we've seen is that the response to the pandemic has been disproportionately negative for refugees and other populations of concern. And I'll just give a few examples here. So if you look at other studies, such as the one from the Center for Global Development and NRC, you know, they've also highlighted early on how COVID exacerbated refugees' limited access to formal labor markets, social protection programs, leading to increased poverty. Moreover, because we are unable to address the economic impact, we're seeing an increase in negative coping mechanisms, what we call protection concerns, for families to meet their basic needs. And Christine mentioned issues around education, but even before the pandemic, 48% of children were out of school, and lessons from other pandemics responses where we had extended school closure have shown that girls are less likely to return to school afterwards. So I would say, you know, these surveys, as we look at the results over time, it'll be really interesting to see whether that also plays out in this pandemic. As the virus spread, more and more states implemented measures to contain it, including closing their borders, even to asylum seekers. And that was some 100 states who weren't allowing asylum seekers access. Despite less than ideal situations in home countries, some refugees have chosen to voluntarily repatriate, as they've been forced to because they've lost their jobs, freedom of movement, and are unable to meet their basic needs. And I think the other thing we've seen in certain places is that xenophobia has been on the rise. With the incidence of the virus in many countries, refugees facing verbal and physical abuse, eviction, stigmatization, and greater marginalization. And, you know, we've seen in the past, we know it's very easy to blame refugees for certain health crises. On the other hand, what's been strangely what I would call, quote unquote, positive that's come out of the crisis is that because the virus is not discriminating, it's given more visibility to the need for inclusion of refugees in national systems, obviously health being the initial focus. And this will certainly be the case for vaccine coverage. If you look at a situation like Lebanon, where we have 1.7 million refugees, about 1/4 of the population of Lebanon are refugees, you can't imagine that the government would not want refugees to be included in health and vaccine coverage because it has an implication for their own population. So considering the limited evidence to date, the current crisis has underscored the fundamental need for timely socioeconomic data in displaced settings in order to fully understand the conditions of refugees and other populations of concern, and with the underlying goal for appropriate programmatic response measures. Not just for UNHCR, but this data will also support what's needed from institutions like the World Bank, the African Development Bank, our bilateral development actors, in terms of their programming that doesn't come through HCR, but supports refugees and host communities in situ. So, what we've seen, we know what gets counted counts. And this has really given us an opportunity to make sure that our population is getting counted and in national surveys, and that is transformational for UNHCR. And, we really applaud the work of the bank and the JDC to include refugees in these national surveys. UNHCR has also taken on a bit of work on its own in places where the bank hasn't been active, in Costa Rica and Mexico, to do this, because we think that this type of data that's comparable is really important for us. So increasing the availability of this data that's both representative to the wider forcibly displaced population and comparable to nationals has long been a challenge. And even before the COVID-19 pandemic, we were working with the World Bank to try and include refugees in these types of national surveys. What makes this powerful is the fact that the data is being collected in waves, and that allows us to analyze trends. And that's something that has been lacking until now in UNHCR. So, some of the key early findings from the data, some of which was mentioned by other colleagues in this talk. But, in the case of Kenya, for instance, the World Bank's online dashboard allows you to quickly see some of the major trends across time for both refugees and non-refugee households. In that context, understanding how refugees differ from nationals along a range of thematic indicators helps country and regional colleagues plan and design their operational programs in response to what they see. While we will need deeper analysis, and this is being undertaken, you can clearly see how the differences between refugees and non-refugees in that context with respect to employment, access to services like education and healthcare, food security, and more is critical. And we think that this will really help sectoral experts to be able to integrate that information into their planning and programming process. Lastly, I would say this type of information is extremely valuable when it comes to understanding how certain populations, including refugees and others, react to the pandemic and whether their behavior will help mitigate further spread. So thus far, the data indicates that knowledge about COVID-19 by our populations of concern is near universal, and they are using mitigating measures such as hand washing, social distancing, and the like. Interestingly, in the case of Ethiopia, 93% of refugee respondents say they'd like to get vaccinated if an approved vaccine was made available at no cost. So how this data is being used? At the strategic level, it helps the institution to make the case with member states and other partners in terms of the value of inclusion and more open policies, for example, in national services, such as health and socioeconomic inclusion. The data is directly applicable to the immediate programming response. And I can say, for example, this has had a huge impact in how we look at cash in order to mitigate the negative impacts of unemployment, and strategic policy development in major refugee hosting countries. UNHCR operational colleagues find this sort of information valuable, allowing them to better design their activities in light of other firsthand information and knowledge they have in their respective countries. Moreover, we believe this data will help inform internal planning processes. UNHCR has just undergone a new approach. We're an annually funded institution, but we've taken on a multi-year, multi-partner planning, which we haven't done in the past. And this kind of data will really help us to look at our situational analysis and in that planning process. It'll help us to get a better handle on where priorities exist and feed into more informed resource allocation within countries and within regions. And finally, the underlying aim is to make this data widely available on the UNHCR and World Bank microdata libraries as soon as possible, with the hope that access to this data will serve many actors to help create more positive outcomes for refugees and other populations of concern. I'm done, Bjorn. I think I met your timeline before The Economist did. Over to you.
You did very well, Betsy, and a lot of pertinent points that you make. I think what's really great about this, what we're seeing today, is the timeliness of the data, and you also bring out the trends, the fact that we have trends data, which I know is quite unique in this space. So I think we're really seeing some groundbreaking work being presented here today. We have a second discussant, and that's Marguerite Duponchel. Marguerite, I think you sit in the Republic of Congo. I think you cover both the Republic and DRC in your work, and you're a senior development officer. That's right?
Thank you, Bjorn. This
You
is
have
correct.
the floor.
It's hard
You have 8 minutes.
Thank you. This is hard to talk after Betsy and all her good points, I have to say. But first of all, thank you very much for the opportunity to comment on this extremely interesting pieces of research. And I should mention that, unlike Betsy, I am an economist. So it is great to see how the research community and the data collection methods have swiftly adapted to the conditions set up by this pandemic. This is also great to observe that there was a successful push for inclusion of persons falling under our mandate at UNHCR. Betsy said it, this is of tremendous help. There is no doubt that this analysis, sometimes with somehow unexpected results, are important pieces to contribute to the growing but yet insufficient literature on forced displacement, and to enable us in operations to better understand coping mechanisms and assist our persons of concern, refugees, asylum seekers, returnees, IDPs, and of course their host communities who are in the front line when it comes to supporting the displaced with the difficult situations. I look forward to see more analysis come out of this very rich data, maybe even beyond COVID-19 impacts. It is for sure an important lesson to take home at UNHCR. With only 15 minutes, interviews over the phone, a relatively cheap exercise, surely a lot much cheaper than they used to be, we can document with numbers the situation on the ground. Of course, within the limits that such data collection exercise can entail, as highlighted by the presenters, including the mobile phone penetration. Additionally, once more, it shows us at UNHCR that progress, the data that I believe was used to identify respondents in Ethiopia, can be used way beyond caseload management. It also highlights the variation depending on context, a very little significant difference, for example, in Yemen, where both the IDP communities and the local communities have been for so long facing daring conditions. In that regard, it is important to continue to emphasize on the displacement context of the analysis, such as camps or sites versus locally integrated population, the history of displacement, when this population were displaced and why, etc., etc. For example, in Yemen, are we talking about similar population? Are we talking about displaced population that speaks the same language, that are coming from the same ethnic group? In Ethiopia, the groups looked at are very different, but are we comparing the same when we're comparing to the local population? Are we comparing rural areas to rural areas, urban areas to urban areas. And I hope that you will be able to find some ways, like discontinuity design, for example, to answer some questions moving forward with the analysis. In Ethiopia, the results do show us that in some aspects, including access to certain essential goods, refugees are better off. But still, the results point out to distress cells, which is of utmost concerns to UNHCR, particularly for the most vulnerable, who have already so little. The results on education are particularly important to flag. And while I'm sure our colleagues are very well aware as in our operation in Ethiopia that refugee children have less access to education, it is of importance to put numbers on this. And such studies do very much support the efforts of UNHCR operations on the ground in the dialogue with the stakeholders at country level. This is always very helpful to have other voices to point out to the limitation faced by forcibly displaced. One suggestion maybe would be to look into more details into gender-specific aspects of this impact. Ultimately, when data shows that refugees and IDPs are the same or better off in some aspects, it is also very important to continue to nuance the results by emphasizing that the displaced population do face specific protection challenges due to the status that goes way beyond livelihoods and economic aspects, such as restricted rights, difficult access to civil documentation, and it goes on and on. This is particularly important to support our advocacy for inclusion of persons of concern to UNHCR into government systems as part of the engagement under the Global Compact for Refugees. Finally, if the authors would like to provide some feedback on the lesson learned and the do's and don'ts of collecting data quality data remotely, this would be of great interest to hear. Ultimately, it gives us a lot of ideas at country level on how we could improve in the future and use the latest methodological innovation to monitor the impact of shocks, starting in Congo, in both Congos, with the ongoing emergency and the arrival of tens of thousands of refugees since the election crisis in the Central African Republic, and help point towards directions on how we could fine-tune our programming based on robust data analysis. So I will stop here. And again, thank you very much for giving me the opportunity to comment on this important research.
Thank you, Marguerite, and thank you for posing a lot of good questions, challenging questions, I think, to our three presenters. So we have another 10, 11 minutes of this webinar. I wanted to put up a slide very quickly, if I may, Catherine. It's a slide from the paper that I referred to that we published in December. Which has and the authors have developed this model of the transmission mechanisms of COVID on forcibly displaced, we're just gonna show it to you for this half a minute, and suggest that you have a look at the paper and you know, be inspired by this model that was developed for this purpose. I think it was Sashio who talked about similar transmission mechanisms. Thanks, Catherine. The other piece that I wanted to draw your attention to is work done in MENA on Syrian refugees in the Mashrek region. Evidence from 3 different parts of the Mashrek, Lebanon, Jordan, and the Kurdish region of Iraq. Which uses a different method, which uses modeling to assess the impact, socioeconomic impact, I think, on poverty, particularly on poverty levels, which is another way to do it if you have a good solid data set to work with. which is often the case and not the case. Anyway, back to our phone surveys, and perhaps I can let me put questions to the three presenters here, taken from the Q&A chat. For the first one, to Christina. Question is, why are refugee outcomes so different by refugee groups? You said, for example, that Somalis have higher rates of work. They receive assistance in school openings, while Addis refugees' incomes was much more likely to be reduced. What explains that large heterogeneity? And Christina, feel free if you have any comments on the questions posed by Marguerite or others, or if there are issues that you were stimulated by your colleagues in their presentations, please go ahead and say so. You have 2 to 3 minutes.
Thank you very much. So indeed, so the outcomes across refugee groups are very different. This is to some extent something that surprised us as well when we did the analysis. We had a lot of in-depth conversations and discussions with our UNHCR colleagues. And essentially what it all boils down to is two things. So Addis Ababa I have very unstable connections. I'm just going to turn off my video. I hope you can still hear me. So yeah. Refugees living in Addis are actually quite different from the other refugee groups because they live within the host community. So those are the refugees that are not in camps. They live out of camps, and thus their socioeconomic outcomes are substantially different from the Eritrean and the Somali refugees, the majority of which lives in camps. So that's one big difference, that we see quite different socioeconomic outcomes between out-of-camp settings and out-of-camp settings. And of course, the second biggest contributing factors to those differences is that these groups are very homogeneous within the group, but very heterogeneous across the groups. So Somali refugees are very different culturally, religion, language, etc., from Eritrean refugees, for example. And this, of course, also creates some of these differences. One thing that surprised us the most, and you did pick up on that, is that Somali refugees actually have the highest participation in education, or children of Somali refugee households. This is not necessarily something we expected, and UNHCR is also currently looking into it because it is something that they weren't surprised or they weren't aware of to this extent. Then some of the questions or rather comments that were made by Marguerite, I mean, I fully agree. It will be very important going forward to think about how we can construct lessons learned from all of this data collection effort. So I think there's a lot of cross-fertilization that we can take advantage of, and a lot of learning that we can do for future engagements. And future engagements can, should not only be happening in response to a shock or a crisis, but also we can think about, collaborating a lot more and implement with UNHCR and the World Bank and implementing some of these more innovative data approaches. And then the last aspect is that, of course, a lot more in-depth analysis can be done and should be done based on this data. And so this is why it's very important. Just want to reiterate what Betsy was saying, that we make sure that we make this data publicly available in the microdata library. Because of course, I mean, the responsibility of full analysis does not only lie with, us, JDC, UNHCR, to make this data available so the larger research community can utilize it. Thank you.
Thank you, Christina. Let's go to Sharad. You may have seen, Sharad, that there are a lot of questions around the sample bias in the phone surveys. And I think the question here is how have you avoided or mitigated the uneven distribution access to phones in the target population? And specifically, phone ownership and usage is rarely equal between genders. Alternatively, do displaced people have access to strong signals to be reached in camps? And how can phone surveys overcome bias in selection and response? Again, feel free to also to respond to other observations by colleagues.
Unfortunately, that is a very, very good question. And yes, it's very, very difficult, and we do the best that we can. You know, and we do account for somewhat. And so one thing that we try to account for is the fact that, you know, the more mobile phones you have, the more likely you are to be contacted through the procedure. So we do adjust our sampling weights based on the number of mobile phones people have. But aside from the, you know, the fact that there are certain, you know, populations that just are never going to be, you know, captured by this survey methodology, and that also includes some rural areas where signals tend to be poor, and they're chronically undercovered. The JDC is actually helping to fund some expansion of this monitoring to really focus on areas that are hard to reach, particularly districts where have been underrepresented over the past year and a half or so of the survey, to really try to increase the sample sizes from those places. But it's a difficult problem, and you know, this survey methodology has you know, kind of holes that we aren't going to be able to cover. But, you know, at the same time, we're using other sorts of means. You know, we're doing local government surveys, we're doing key informant interviews, and using project-specific data from the World Bank and humanitarian agencies to really try to fill in some of those gaps. So it's very much the case that one survey won't cover the entire population, and we try to take that into account. The one thing, I'll stop talking now, but the one thing I wanted to mention about Marguerite's many excellent points in that I really like the point on, you know, that access to food and access to these indicators we're using of welfare only captures part of the story. And that's something where we are trying to work on, you know, in terms of discrimination against IDPs and you know, amongst host communities and all the various needs that IDPs might have. You know, we're really trying to use other survey methodologies to try to complement these things. And we're also using JDC funding to expand and do specific questionnaires solely devoted to displacement and to really get, you know, more information to help answer some of those questions, and then also to help answer some of the questions you had about, you know, heterogeneity. Is it, you know, what characteristics of certain displaced individuals are more likely to experience some of these poor impacts? But I'll stop there. Thank you very much.
That's great. Thank you, Sharad. I want to be as respectful as I can of people's time. We're 7 minutes over, but you know, we still have more than 70 participants. So I gather there are more people than me who find this a fascinating conversation, which could go on for very much longer. I picked up on, Sergio, your last point here, and we also heard it from Yemen. Some really good examples of interinstitutional collaboration with UNDP, with WFP, obviously with UNHCR, and that is so good to hear. Also great to end on your note here, Sergio, with the call for an inclusive agenda. It's straight from the Global Compact on refugees. And we at the Joint Data Center we're really behind all efforts in whichever countries want to get on board with that inclusion agenda, statistical inclusion agenda, which is closest to our heart, this group here. I think you also gave some really good examples of what's going on here in terms of capacity building. Working with the statistical agencies and other agencies at the country level. It is truly some groundbreaking work, so wonderful. So we had some 25 questions in the Q&A chat, and what I think I haven't been able to monitor in detail, but I think that have have been responded to. It's just a huge benefit of doing this online in this way. Let me end by just giving my appreciation to our two partners who we've worked so well with over the last month, IPA and SIGA. And given the response here, the level of participation and the activity on the chat, we will consider continue this mini series. And if you have any suggestions for what we should cover next time, please don't hesitate to be in touch with colleagues. And let me just end on a thank you to my own team, the colleagues on my own team who have made this happen, both from a substantive point of view as well as on the logistical end. I think it worked seamlessly. Thank you so much for all the hard work. Everything here is, as I said at the outset, has been recorded. So please go back and watch if you'd like to see it again. Also, the presentations that have been done will be available on the website, so you can access those separately. Good. I think with that, let me close it out and say that looking forward to seeing many of you soon again in a similar kind of setting. And thank you for attending, and thank you for being so active on the asking questions and engaging in the conversation. Thank you.